Hi, I'm Hilary Talbot, acupuncture physician and clinical herbalist. Today we will be discussing acupressure for acidity. Now, acupressure for acidity could mean a couple different things. Maybe systematically your pH balance is off, or perhaps it's as simple as just experiencing some unwanted reflux or heartburn. So today we're going to discuss a point that is good for the symptomatic relief of heartburn and reflux. That point is called PC6 or Neiguan. It's a point that we often use in Chinese medicine because of how effective it is. It often amplifies other points that we use in the body, but this one is specific to nausea, heartburn, motion sickness, is for its effectiveness. To find this point, you just locate it between the two tendons on the inside of the forearm, and it's usually right after the vein crosses, about 1 or 2 finger breadths down. So on our model today, it's located right here. And what you want to do is do some light to moderate pressure on this for about 15 to 30 seconds, and probably about 5 to 10 times in order to get a good effect. This point is located on both wrists and can be used on either one. And I also recommend putting one hand on the belly while you're doing this and taking some nice deep breaths and just kind of picturing everything coming down. And what this point does anatomically is it has a specific effect on the lower esophageal sphincter. So that's the little flap that sits just above the stomach, and that is often sometimes a little bit lacking in tonicity, and it allows the acid to come up, and that's how we experience it as heartburn or a pain in the chest. Also, a point that you can do locally in that area is one located where the ribs come together at the sternum in the xiphoid process. And you're just going to use 2 fingers on either side, right in these hollows, and gently stroke down. And this would be good to actually invigorate the tonicity of the LES to prevent future heartburn. So this is something that you could do simply while you're laying in bed at night, even when you're not experiencing it, as a preventative measure. Now, there's lots of different things that can trigger acidity in the body and underlying patterns that we would use to properly prescribe herbs or give you certain acupuncture points that would be specific to you. So if you haven't already, I encourage you to seek out your local acupuncture physician and get a diagnosis specific to you. Thanks so much for watching.